senior officials. Once the statements have been concluded, you'll be given time for question and answers. I give this time to the witness.
Thank you, Mula Bilaka, to members of the media and to all those who may be listening in. Today's press conference is essentially just to provide an update on a number of aspects that relate to our COVID-19 response. To date, we've gone through 3 phases. We went through an initial phase where we had to clear the country of the COVID-19 virus. And we did early diagnosis and containment during that phase. We then, once we knew that the country was cleared of the virus, we then moved into a phase of trying to ensure that we maintain the containment. And that was through quarantine. And now we are moving into the next phase where we try to protect individuals from the effects of COVID-19, and that is when we're moving into the vaccination phase. I need to reiterate that all our phases are based on scientific approaches that have been proven, tested and proven. So all these phases that we're going through are not phases that we have made up. They are phases that have been tested and proven for many, many years ago. So what we're going to do today is that I've got the 3 of the 4 speakers here. First, I'll let Dr. Alicia just to update us on the situation as regards to COVID-19. Then I will have Dr. Anna Maisema to discuss a little bit an update on our quarantine control measures and what has happened so far. Then I will get Dr. Rachel to discuss more with regards to our vaccination program. I'll finally get our Chief Medical Advisor to just provide a roundup of some of the key issues that that have been mentioned, and then we will be ready for our question and answer. So without much ado, I'll let Dr. Alicia begin the presentation. Thank you.
Thank you, Dr. Fong. I'll just give a brief on where we are in terms of COVID-19. All of you will be used to this brief because we release this from the Ministry of Health every Monday, Wednesday, and Friday. So as of today, we can report that we have 0 new cases of COVID-19 to report. It's been 10 days since the last border quarantine case of COVID-19 was reported, and there have now been 3 new recoveries, which leaves just 1 active border quarantine case admitted at the Lotoka Hospital Isolation Unit. It's now been 333 days since the last case was detected outside border quarantine, and that was on April the 18th of 2020. So in total, we've had 66 cases since our first case was detected on March the 19th, 2020. And of those 66 cases, we've had 63 recoveries now and 2 deaths. And the last 48 cases have been in persons returning from overseas and detected as cases in border quarantine. We've done a total of 34,346 laboratory tests for COVID-19, and our daily average for testing has been 248 tests per day for the last 7 days. And our weekly average has been 1,615 tests per week for the last 2 weeks. There are currently 949 people who have returned recently from overseas, undertaking 14 days of quarantine in our border quarantine facilities, which are government supervised. So this is supervised by the Ministry of Health as well as the Republic of Fiji Military Forces. And as always, this update and more detailed updates are available on the Ministry of Health and Medical Services website. And the next update will be this Friday. Thank you.
So more than 12,000 individuals have come through our borders since last year, and all these individuals have gone through stringent quarantine conditions before they were cleared to join their family and friends. So since we began the repatriations around April in 2020, we certainly have had many variations of quarantine, and You must have heard about the Blue Lane Initiative, where more than 90 yachts came through our shores. And other initiatives include the Vacation in Paradise for luxury hotels and guests, the HMS Adelaide Quarantine Corridor, and of course we have medical, some of the passengers that are returning with medical conditions who needs the medical care during their 14 days of quarantine. As we've always mentioned in our updates, the quarantine conditions are maintained by the Ministry of Health and Medical Services team. We have the Royal Fiji and Military Forces, the Aviation and the Maritime Agencies, and then we have the quarantine facilities and the quarantine transfers. We definitely have all heard about the evolving variants, and with these variants, the team, we have reviewed our SOPs to make sure that we mitigate all possible risks, and this is another guidance of the COVID-19 task force. As mentioned by Dr. Alicia, we currently have 949 individuals in 10 of our quarantine facilities, and as such, all these individuals have to go through the 14 days quarantine, and they have two, an entry test and an exit test. And clearance is subject to a negative COVID-19 test. If there is a positive result, they are managed within our COVID-19 clinical guidelines. I think recently, after the announcement of the amendment of the Public Health Act, where returning Fijians have to cover the cost of their quarantine costs, there have been a lot of inquiries coming through the ministry. The exemption criteria is very clear, and individuals traveling back who think they fit the criteria can apply for exemption. We will certainly cover more details in due time. We are, again, very thankful for the vaccination, especially for our frontliners. This is definitely another layer of protection for our country and for the frontliners. However, the 14 days quarantine conditions will not change despite the vaccination status of an individual who is traveling to Fiji. So thank you, and I give it to Dr. Rachel to give us an update on...
Thank you, PS, and members of media. So I'll just basically take us through the COVID vaccine registration process and COVID vaccines to date, what's happened and what's the progress in terms of Fiji. So Ministry of Health, we've gone out live as of this morning in terms of registration and opened it to the general public. Basically, there's and we've worked. I must say, we've worked very closely with Digital Fiji in this, in developing this particular platform for registration. And while it's gone live, I must say there's a few ways one can do registration. And with the live platform that's gone out, that is self-registration individuals can do. Now, self-registration can be easily done if individuals know a few information, and these informations are the birth registration number. And apart from the birth registration number, you need a photo ID card. And for these cards, we would appreciate if there's a voter card, a TIN card, driver's or student's card, basically which verifies individuals. So apart from the self-registration that has rolled out generally, apart from the birth registration number, there are other individuals who fall into the citizenship certificate number category as well. Basically, citizens who've got who currently have dual citizenship with us. So that's where the citizenship number comes into play. And they can use that number as well with the other essential I mentioned earlier. Apart from this self-registration, we will be opening up opportunities for face-to-face, where Ministry of Health will be leading that process. And we're working very closely with our NGO partners in rolling this out. And even at all our health facilities, we would be registering individuals face-to-face on site as well. And this is basically to ease the whole process. And it would not necessarily just be at health facilities, but even to the point in communities, high-flow traffic areas, which we're identifying at the moment, high-populated areas in towns and cities and communities. So basically, like I mentioned earlier, what you need for registration is a few things. Birth registration number if you're born in Fiji, citizenship certificate number if you have come in later. Yeah, and a valid photo ID. We're identifying as well means of registering individuals with permit holders. that is currently in the process. And as soon as we get this available, we'll definitely communicate to the public at large in registering them. But we're really encouraging all individuals to register. Registration doesn't mean that you're consenting for vaccination. Basically, on the day of vaccination, you sign off a consent form, an informed decision made by all individuals of information provided to everyone being vaccinated. So a consent form is signed off on the day. In terms of sourcing birth registration numbers, one of the things we're really trying to do is not burden Fijians in getting their birth registration number. So in doing this, we're working very closely with the BDM and likely with Post Fiji as well, in allowing Fijian citizens out there to go to these sites, that either the BDM offices or Post Fiji in the near future as we confirm finer details, and allowing them to just do that birth registration number search. That's the only thing that they'll be able to do, so it avoids the cost in terms of printing out a birth registration, birth certificate. So because we're mindful that we don't want to tag any cost in terms of registering all individuals in Fiji. And apart from sourcing it through the BDM offices and other, we're also looking at all health facilities across the country. And like I mentioned earlier, the health team, which will be mobilized across using NGO partners. Now, in this process, we are encouraging all individuals who are eligible for vaccination. And when I mean eligible for vaccination, this is individuals 18 years and above. So we're encouraging all to register on the platform. So that is an encouragement. And we intend to at least close the date by the last date of April. So at least we're encouraging all to register. We must, I believe, register ourselves on that platform. So, like I said, the online is available. The health facilities are available for this. And our team on the ground will be mobilizing to the whole country in getting this registration done. And where need be, for individuals who may have lost any form of ID card because of the recent floods, etc., we are working very closely with the elections office, and when we identify that, we will mobilize with a team from the elections office to ensure that the ease is individuals are made at ease in availing themselves with an ID card for the registration process. Now, Fiji also received, as you all know, 12,000 doses from COVAX facility about a week and a half ago. And this was on the 6th of March. And moving on, soon after, a few days later, we rolled out the vaccination campaign mainly for frontliners. And the 12,000 doses, I must say, is a portion of the 20% that the COVAX facility has committed to the country. Not just Fiji, but all countries across the world. And in this process, basically what happens is the 12,000 is a portion of what's coming. It will trickle in over the few months ahead of us. But we're anticipating that at least by the end of April or early May, we could get about 100,800 doses to vaccinate as the identified individuals. Like I mentioned, trickle in batches. And when we started on the 10th of March, to date, we have vaccinated about 94% of the initial target population of the 6,000 we had. The initial target were frontliners, and when I say 94%, it's basically 5,653 individuals have been vaccinated as of this morning, and we will get more update in terms of data as we progress, because vaccinations are still ongoing today and tomorrow as well. So this was the initial rollout. And with the initial rollout, we have not seen any adverse events, though we have seen side effects, such as simple things like fever, chills and rigors, or a bit of joint pains, a bit of headache, but nothing major that required individuals to be admitted because of the vaccination itself. Basically, this goes within 24 to 48 hours, and that's important to note. And with this, we're really encouraging when individuals are vaccinated to make sure that when you do have a fever, just take the simple measures such as paracetamol and increase your fluid intake. But and this is a normal response of vaccination. basically saying if our kids right now get vaccinated, that we advise the same information to parents to make sure you've got paracetamol at home. So when the child is vaccinated during their immunization schedules, they get to get this. They are ready to address that fever if they do have it. So this is basically our body trying to develop the antibodies, soldiers to fight the COVID-19 virus. And now in terms of rolling out plans, we've, like I said, first phase was this 6,000 individuals, which were frontliners. And this frontline were healthcare workers, the ports of entry, sea and airports, isolation facilities, individuals who worked in these facilities, quarantine facilities, and our defense forces who've been supporting us, like Dr. Ann and Alicia mentioned earlier, how they've been controlling in the quarantine space. Now, the next phase will be to the rest of the frontliners in Fiji, which is again healthcare workers, because we've focused a lot of the healthcare workers currently in the West, because that's where the bulk of these quarantine facilities and isolation facilities are. So the next is basically the other healthcare workers and the defense and other frontliners that we've identified, including the vulnerable individuals with comorbid issues. So basically what I mean by comorbid issues are individuals with diabetes, hypertension, cardiac issues, but obviously it doesn't limit to that, but it makes them vulnerable. Now, why do we choose this population? Is because we've seen that globally the death has been mainly amongst this population, so they become vulnerable to to coronavirus in itself, thus making sure we protect them. Now, phase 3 obviously will be ultimately all individuals above the age of 18 when we roll out. So just encouraging once again now, we ask all individuals above 18 to register. Registration is open, and we look forward to that. And like we mentioned, last date of April would be the day of registration we're putting at this point in time. Thank you.
Maybe just to reassure members of the public again that the Ministry of Health has been following up closely on the development of the disease and the progress of the disease and the development of measures that we are taking to address the COVID-19 pandemic. We must remember that this is a new disease. It's not only to Fiji, it's new to all of us. And we are all learning as we go through in tackling the disease, not only in Fiji, but we are learning from the experience of other countries. The vaccine is new. As we are taking it in Fiji, other countries in the world too are having it for the first time. So we are also going through the same experience. But it's important to note that the vaccine is only one of the many tools that we are using to address the COVID-19 pandemic. So it's an added tool to our arsenal of measures as has been presented earlier. The various measures that we had taken right from the start, and then the vaccine has come in with the border control, the quarantine, the isolation, the measures that we used when patients came into hospitals. All those are part of the public health measures that were needed and are needed. And that includes the non-pharmaceutical interventions. We are still telling people, wash your hands, make sure you protect yourself when you cough and sneeze, and those measures are important. And the vaccine is, again, an added tool to what the country and what the rest of the world is employing. So the vaccination is going to be a big deal for us. It's going to be a big exercise. It's going to involve a lot of people people in the ministry. We are involving also people, our donor, partner organizations who are supporting us in the two big processes that are going to happen for the vaccination. We need people to get registered, and we need people to get vaccinated. So those are the two big things. And as we roll out, we are again seeking the support from members of the public, members of the community, that you should come forward, partner with the Ministry of Health, and make sure we engage together as we are moving forward and using all the tools available to us to address the COVID-19. As explained by Dr. Rachel, there is a reaction when you get the vaccine. There should be a reaction because the vaccine introduces a little bit of the picture of the virus, and the intent is for you to react. When your body reacts, then you are getting protected. So if you don't react, you should react. It's just there's always a variability, difference in the way people react. Some people get a lot of chills. Some people get a bit of headache, and that's it. And some people don't feel, and that's just in the individual differences that we have. But our mothers know this, our wives know this, because whenever they take our children, our babies for vaccination, they'll come back, no sleep the next night, because the baby will be crying, will have a bit of a fever. Then as soon as the body acclimatizes, then they get better. So that's why we're asking your support. We're asking the support of the members of the public, support of organization, and particularly leaders in the community. We are asking for your support to help us. So as we roll out with the registration and the vaccination, that we'll be able to do it seamlessly so that we get to our target and protect our target population. Thank you.
As you roll out the vaccination registration, countries around the world, especially the European countries, are halting the use of AstraZeneca vaccine. What assurance do you make the public that these vaccines are safe as you roll out the vaccination process?
So quite recently, the introduction of AstraZeneca in Austria was associated with some clotting events. And those clotting events instigated Austria to put a halt, and everybody else did the same thing, but as a precautionary measure, not for the purpose of anything more definitive. Now, we are assured in that most of all the experts that we speak to, these are the experts, I'm talking about people who actually do vaccine specialists, they dispute that decision because for a number of reasons. Number one is that the problem that they find that with those clotting problems, they were never found in any of our initial studies when they were field testing the vaccines. Number two, clotting incidents occur 1 in a million. That's the number of people that were vaccinated in the UK was around 11 million. So out of 11 million in that population, you expect to get at least 11, 12 cases, and this is we talking about 2 or 3. So in fact, in the vaccinated population, the number of clotting incidents is much less than in the general population. So this is why we are quite puzzled as to why there is such a reaction. The other thing is that we also know that there is no biologically plausible reason why any of the particles of the vaccine will interfere with your clotting system. So based on all those parameters, and also now we got the statements I've been saying has been agreed upon by WHO, even the European Medicine Agency, EMA, which governs the countries that are doing the suspension, they disagree with what has happened. And right now, Australia TGA have also put out a statement to say that there is no reason for us to stop vaccination. One of the things that we all have to be clear about is vaccines prevent severe disease and death. and hospitalization. Severe disease, death, hospitalization, that's where it is very, very strong. The rest of the other outcomes, mild disease, asymptomatic infection, and transmission, all that we are still trying to work out. But first of all, one of the reasons why we need to bring in the vaccine is because we need to prevent the possibility of severe disease, death, and hospitalization. And finally, I just wanted to say also that as a human race, we cannot live like this forever and ever. We need to be able to open our borders. Otherwise, if we continue this way, more and more people will get less and less money. We will then begin to have the health effects of poverty, and then we will have nothing to fight those health effects. So for us, it's imperative on the Ministry of Health, for us as part of our public health response, to make sure that we can move towards opening our border and improving economic recovery. It is for that purpose that we feel that apart from every other reason for giving in vaccination, we also need this to be part of the reason for giving in vaccination.
Put that aside, what monitoring mechanism do we have to keep a tab on? How are we keeping a tab on side effects on people that have been vaccinated?
Thank you for that question. A very good one and a very important one as well. We haven't been monitoring vaccines just from today with the COVID vaccines. We've been monitoring adverse events from the time vaccination started in Fiji. That is an important part of our system. So basically, every training, every nurse out there, every doctor out there knows that if there is any side effect, any adverse event, that needs to be reported, that needs to be done immediately. So there is existing systems in place, which we haven't developed new, but we've just strengthened it. And every individual team out there that goes and notices anything, they report immediately back to us. And if there's anything that's extreme, for example, any hospitalization secondary to the vaccines, any extreme anaphylactic reaction, they should report within 24 hours, like an ASAP thing. So these mechanisms are in place.
So Rachel, this talks about vaccine passport around the world. What form of verification will people who have been vaccinated will receive?
Again, when I spoke about economic recovery, this is what we are talking about. One of the issues that does make our current vaccination program a little bit more complex is the fact that we need people to register, and then we need to vaccinate from within the group that's registered. So that when we click a button and say that's one injection, 2 injection, you get to receive a card that says you've received it, and it's got a unique number on it. That particular card, if somebody doesn't believe you, they go and they read off that unique number in one database. They're supposed to see that your name is in the database. And this is why we have been working very hard to ensure that we register first before we get vaccinated. Because it is associated with this added long-term issue around getting Fijians back on their feet, putting food on the table, and getting to be able to live a more healthy life.
Just my final question. This week marks the year since we recorded our first COVID-19 case. Can you just elaborate on the past, the experiences, and what was the lesson learned throughout the year?
There's been so many.
You'll get a number of people to answer that question. Well, okay. Personally, for us, it's been a difficult journey. I think CMA has mentioned. A lot of us medical people, we've had to step outside of our comfort zone in order to look at other aspects of that impact on health. As I said, the most important bit we talked about was economic recovery. We've had to deal with the effects of ongoing quarantine, the effects of isolation. We've had to deal with all that. We've had to redo our quarantine protocols, the protocols that we run in the hotels. we've had to do a lot of work to ensure that our quarantine program is a health program. It's not just a program where people just come in, stay for 14 days, go out. No, you come in, you stay for 14 days, and there's some other measures that are in place to make sure that it remains, to do the function that it does in preventing COVID-19 from getting into the community. So we've also had a lot of other experiences to learn from, and we've got new protocols to help us deal with sick people, our ICU cases. All those protocols have changed. One of the biggest area of change has been at the seaport. We've had to change a lot of our quarantine protocols at the seaport because the seaport is now functioning in a different way. It has to function in a different way to keep our Fijians safe. So that question is fairly broad. It does involve a number of different aspects that we have learned from. I guess the last bit that I should mention is that we've also re-engineered our health system to be able to respond to this type of problem. Our health system, what we did was that we rebuilt the health system to make sure that it has a lot of outreach capability. You would have noticed that when we had the acute phase of the COVID-19, people were going into the community, doing all sorts of screening, looking for contacts. When we had TC Yasa and Ana, we had people going out into the community, cleaning up the place, helping to sort out the health effects. Now that we're having a LTD outbreak, we're doing the same thing. You bring in the vaccine, we're doing the same thing now. We're taking people out to go and do the registration, do the inoculation. It's all these lessons that we have learned. And one of the most important lessons that we have learned is that we have to reinvent our health provision model so that we can adapt to the new times.
I remember we first started our press conferences just before we had our first case. A lot has happened in that intervening time. I remember at that time we were talking about flattening the curve. That was our focus, flattening the curve. And thankfully, looking back, I think all of us can be proud of where we have come in terms of specifically COVID-19 and keeping it out of Fiji. We have, it's undeniable that we have been very successful in doing that. But as Dr. Fong has mentioned, there are a lot of other things for us to worry about at the same time. And as health people, this is something we continue to worry about, and this is why we're taking all of these measures to try and get Fiji moving again. Thank you.
We're trying to do that for all. We're trying to keep that as a benchmark, like Dr. Fong mentioned. Reasons being is so that we're efficient in our process of making sure all are registered, and when it comes to vaccination, we obviously enter the data accordingly, and then the credibility of that data at the back end is important in terms of the vaccine passport that you've been talking about. So that's why we're really wanting to push for that period.
What's the update been since you went live this morning?
Good question. I'll have to reconfirm on that one. But close to 8,000 have registered. This morning, early this morning, probably 8ish, it went live. And we're intending to do a lot more comms around it in terms of doing SMS blasts later this week so that it's made known to all and what they need in terms of getting registration done. Anything you want to do?
Dr. Rachel, only 18 years and above will register or?
The vaccination right now is for 18 years and above, so we're encouraging all individuals 18 years and above. But once we know these vaccines work within the younger population, definitely we'll move in that direction as well. Like I mentioned, the clinical trials that happened before it officially became open to the public for usage was mainly done in individuals 18 years and above. So for safety reasons, obviously we will not go in the direction of 18 below. But eventually, like I mentioned, if we're told that credible research says that yes, 18 years and below is safe, will definitely step into that direction.
What about the pregnant women?
Pregnant women, we don't have community transmission, so that's a low risk. So we're not vaccinating our pregnant women, but it's safe amongst women lactating. So if women are pregnant right now and they in that breastfeeding stage, we're definitely can offer the vaccination. But in the interim, we're keeping it away from our pregnant women. Yes.
So they do not have to register?
One of the things is we're really encouraging all to register. Like I mentioned, registration doesn't mean like consenting and you're getting vaccinated tomorrow. But registering means that we have you in our database in terms of when vaccination comes and you're ready, eligible for it, you can definitely get vaccinated. So encouraging all Fijians to register regardless, and you can always opt, because I'm mindful that the misinformation out there is also going around. So we want that misinformation to change into an informed consent. So registration doesn't mean you're consenting, but you're allowing that opportunity to probably consent even at a later stage when the vaccines are rolling out generally.
I think that concludes the press conference, and the panel now retires.
Thank you.
Thank you so much.